Hey everybody, this is Dilyana Mileva and I'm excited to bring you Menopause Made Easy, a podcast designed to provide you tips and strategy to navigate the changes in woman's body, mind and spirit with more grace and ease. I appreciate you tuning in. Remember to like, subscribe and turn on your notifications so you are updated of each episode release. Alright, let's dive in. Welcome everyone to Menopause Made Easy. I'm your host Dilyana Mileva and today I have a wonderful guest with me, Cathy Whitson. She's a physiotherapist and I would like she to introduce herself, how she helps women in perimenopause and menopause with her practice.
Thanks, Dilyana. It's nice to be here. Yeah, I'm a physiotherapist. I have a special focus with pelvic health. So I help women with pelvic pain and prolapse and bladder bowel incontinence. That's kind of the core function of my practice. And then I became more and more interested in the changes I was seeing, during big time perimenopause. So I started focusing more on that because I realized that there's a lot of women who aren't told a lot about this period of life. We just still think of it as suffering with some symptoms and we get through something. But there's so many things we can do to make ourselves feel better. And so that's kind of where my core focus is now. I really find it quite fascinating, this whole hormone journey.
Yeah, it's so important actually because there's definitely changes in our pelvic floor. It's a very common symptom going through perimenopause. Let's define actually what is perimenopause, menopause, and postmenopause.
Yeah, good idea. That would all be on the same page. So menopause is really just a moment in time. We still kind of talk about the whole hormone journey as menopause, but as defined, menopause is one moment in time. And it's really when we've no longer had a period for 12 consecutive months. Poof, we're stamped. Okay, that's menopause. Then we immediately jump into postmenopause. And that's where we stay for the remainder of our lifetime. So that's on average around age 51, 52, but that can be different for different women. You can still have symptoms during the postmenopausal period, but they should start decreasing. And then, of course, perimenopause is the big time when we're feeling all the changes for those lack of hormones and all the changes in our body. On average, age maybe around mid-40s. It lasts for 5 to 7 years, but again, that could be different for everybody. But that's when we see all the symptoms, and that's, like the hot flashes and the night sweats and the lack of libido and the vaginal changes. And then it can be those less common symptoms too of dizziness or ringing in the ears or that weird prickly sensations all over the body. There's so many to choose from. And some women are going to have very few, some report none. I think the bulk of us are probably in that middle ground where we feel some uncomfortable symptoms, but we're still functioning. And then, of course, there's unfortunately the other end of the percentage of women who really, really suffer with severe symptoms.
What happened during this time with the pelvic floor, muscles, heart, and bone?
Yeah. So the pelvic floor, we have this little basin inside of us filled with pelvic floor muscles, and they function really well. Their purpose is to keep us dry so that we pee when we want to pee or we poo when we want to poo. They help with lymph flow. They help support our organs. So they help support, our rectum, our bladder, our uterus. And then they also help in sexual gratification. So they do lots of stuff, but they really love estrogen, just like the rest of our body does. And so when our estrogen levels start to decrease, our muscles don't have that access anymore. So they become less plump. So it's harder to contract them. And they just don't have the bulk that they used to have. So that's one thing that changes in our pelvic floor. And so we might start to see changes we might start to leak when we don't want to, or, because we can't really access those muscles as easily. They also, they had these really tight little junctions, almost like a really tight, made fence. Nothing's getting through there. And then as the estrogen isn't available anymore, there's little cracks in that fence. And that's kind of what happens in the pelvic floor. And bugs can get in there. So sometimes for some women, they've never had a UTI or a urinary tract infection in their whole entire life. They go into perimenopause and poof, they have a UTI. So those little bugs can get in there. And then, of course, our lubrication. So we lose that ability to be lubricated as well. So we have dryness. And so the tissues kind of thin, they lose their bulk, they become less dry. None of this sounds very good. And then that can relate to leaking. It could lead to a bladder sort of frequency, urgency, painful sex, all those sorts of things happen with the pelvic floor. It doesn't sound good, does it?
Not at all. Not at all. And it can affect how you feel, our relationship, our sex life, and all this. So what you suggest, what is the steps that the women can take to help with that?
So there are definitely different options. We kind of look at the two streams. There's, more the pharmacological, and then there's the non-pharmacological. So if we start with pharmacological or the medicinal route, there really aren't any right or wrongs. It's always best go and, start talking with your family doctor and start that process. But gathering the information, I think, is huge. And the more information women have, even before that first visit to their doctor, the better equipped they are. So from the pharmacological approach, we look at hormone therapy, and then we can look at, antidepressants and things. So initially, when I was looking into all this, I would hear a lot about, geez, so many women are given antidepressants during this time. And it kind of bugged me at first because I thought, why is that happening? They're not actually depressed. It's, lack of hormones. But then as I read further into it, I get it. I understand now how antidepressants work. And it is another viable option. So, if we have our little happy hormones in our brain, like serotonin, for example, when we're going through perimenopause and our brain doesn't have access to estrogen, so all these little chemical reactions that require it to make us feel good aren't there anymore. Antidepressants can help us keep that happy hormone available for longer. So it is another viable option. And of course, hormone therapy, they do a lot more research on hormone therapy. Vaginally, like a topical application right at the vaginal vulva area is very safe. And so that can really help directly at the vagina, that vaginal vulva area. And then it doesn't travel anywhere through the body. So you don't have to worry about spiking estrogen levels if that's a concern. They've also looked at hyaluronic acid. And so they've done some studies comparing hyaluronic acid or products that have hyaluronic acid in them to vaginal estrogen. And they're showing really great promise from that. So that would, again, be a topical application. And so for some women who are super worried about, I don't want to have anything to do with hormones, I don't want to go that route, this is another great option for a vaginal application. You really want to look at lots of stuff. So if we kind of think about two of the other things that happen where you mentioned before, like heart and bone changes, I think those are super important for women to understand, because I don't know about you, but I didn't know much about the changes in my heart muscle or my bones. Like, did you know much about that?
No, I personally also don't know. And most of the women don't know how that changed.
Yeah. And I think that's even more important to know. So yes, these crappy symptoms that we feel, it doesn't make us feel good. But I think it's even more important to understand what the heck is going on to those important pieces that we need. And so we know that with our heart muscles, like our blood vessels, we get that vascular stiffness. So our blood vessels kind of stiffen. They're not as pliable. And so we kind of want them to be nice and pliable so that blood can flow through there and they can contract and they can let go and everything runs along smoothly. But when we age, because vascular stiffness does go along with aging, but then we also don't have that protective effect of estrogen on our blood vessels. And of course, every part of us loves estrogen. So now we've lost that. So those vessels are a little stiffer. So our heart disease numbers actually surpass men in those early years of postmenopause, which never happens earlier than that. So that's kind of scary. I mean, I want to stay on top of that and make sure I can do stuff to help with that. And our bones, our bone density starts decreasing fairly soon, those postmenopausal years. And so the things we can do for this are definitely exercise. We want to exercise. We want to get good heart pumping exercise, and we want to get some strength training in for sure for those two pieces. There's lots of other things we can do around that, but even just at the very basic, just to start exercising regularly, get your heart pumping a little bit, and making sure that's consistent, and strength training, 2 to 3 times a week, even just pushing some weights. And even if for the women who hate that idea, because some of them love weights, some of them hate it, just like everybody, even if you just think, okay, brushing my teeth isn't that much fun either, but I have to do this to keep my bones strong.
So is that all our options, or there's more?
there's other options like we look at supplements, of course. Want to get the right nutrients in. So that's all with diet. There's lots about diet, lots about different nutrients. Understanding what we need for our bones and what we need for our heart is kind of important, because then we're not going down that rabbit hole where if you go into like a store right now and you see tons of menopause products and you're like, oh my God, like where do I start? What do I need? So I think it's kind of important to know what are some really good nutrients that we definitely have to get in. If we can get in our diet, that's great. That's a best case scenario. But as you know, a lot of women are very busy, lots of going on. You can only do so much in that area. So sometimes we just top it off with a few extra nutrients. So we can definitely do that. Stress is a huge thing too, though. So stress and sleep. If women aren't sleeping well, can't expect them to go out and do a bunch of exercise, even though they need it for their heart and their bones and for their brain and everything. Sleep, I think, is the first place we have to start. And there's lots of information out there on sleep hygiene, just doing all the standard things, that nice, cool, dark room, no tablets right before bed, cut everything off, have a little more protein in your dinner meal rather than just a whole bunch of carbs. Like there's lots of stuff we can do as little steps. Get a good sleep first. That is super, super important.
Absolutely. I also think that the sleep is essential for our whole well-being, how you perform, for our energy, how you deal with the everyday life, how you react or not react when you're triggered. So it's related, the stress, the cortisol level, you need to keep them in balance. Can you share some of your more common cases that women come to you to help with pelvic floor specifically?
Yeah, I probably see more women with, I would say, we'll call them tighter or, tighter pelvic floors than looser. So I think most women still think of pelvic floor as just Kegels. We just got to keep strengthening. But oftentimes you have to do the opposite and you have to release. So if we think about the pelvic floor muscles, like any other muscle group in our body, we need strength in those muscles, but we also need flexibility and we need to stretch them. And so I often see probably more women with bladder urgency frequency, and sometimes there can be leaking as well. So we'll first look at pelvic floor, do an assessment, and then get them going on something. If it's just pure weakness, then get them going on a good strengthener and give them some exercise to work on. Or it could be more tight, and then we go down the release road. And I teach my clients how to release those muscles. We use it with breath, and then they start working on those issues. This kind of goes hand in hand with what I was seeing, though, with pelvic floor in perimenopause years and the changes. And all of a sudden, women are saying, I never had this issue before. Like, why am I starting to have pain with sexual penetration? Why am I'm not able to lubricate as well, whereas I always was. So we talk about those things. Things like, say, if for your listeners, if you have dryness issues and you need lubes, just make sure the lube you're getting has a pH that is the same as the vaginal area. So you're kind of aiming for around that 4.5. You don't want to use something in that area that isn't as friendly, because we don't want to change the pH of that. We want to keep it nice and acidic so it can keep the bugs out. And so sometimes the lubes can be quite alkaline and then bugs get in. We don't want that. So kind of thinking about like a 4.5. So if you're not sure, sometimes it's not easy to find. You have to Google. Or I've just actually, when I've been trying to find out, hey, what lubes are good, I'll just contact the company. If they can't tell me, then I'm going to scratch that one off the list. But there are some good ones out there.
Very good. Thank you so much for this valuable information. Let's talk a bit for a short moment about the breath and the pelvic floor. How the breathing is connect with the pelvic floor exercise, and how it's important to actually really learn how to breathe deep to be able to perform in a better way the pelvic floor exercise.
Yeah, it's a little abstract in some ways, right? When you're trying to show somebody how this works, but I just ask listeners, please buy into it, because physiologically, this is actually what's happening in our body. So when we inhale, our diaphragm muscle lowers, our pelvic floor muscles actually kind of lower a little bit. That's how they're stretching. They move together. So when the diaphragm goes down, pushes on those organs, and then the pelvic floor can stretch a little bit. When we exhale, diaphragm lifts again, and pelvic floor muscles lift a bit. So they're contracting. Now, they're doing this all day, but just in a smaller amount, and depends on what we're doing throughout the day. So when we're trying to release them, we use the breath. So if you think about, like, you're stretching your hamstring muscle, pretend you're breathing into your hamstring muscle, right? It kind of helps, but your breath is not moving the hamstring as much. our breath is moving our pelvic floor. When we think about our deep abdominal core, we're looking at our diaphragm and our pelvic floor are at the front of our belly, our deep abdominal muscles, and at the back, our very deep back muscles. They kind of form this little canister. So they have like a roof and a floor and then a front and a back. And so they're all moving together. So that's why we really need to involve the diaphragm. We need to involve breathing. So when I'm checking, I'm doing an internal, so I can cue and help my client feel the motion. And I'm just trying to encourage her as she's inhaling. Can you feel a little bit of motion in the pelvic floor? It's very subtle. And sometimes we'll add in other things there. But this is kind of the start of it. I'll also encourage women, because this is hard to feel sometimes. It's not a big feeling. And, people don't think about the pelvic floor this way. They just think squeeze, squeeze, squeeze. So sometimes it's easier to sit on something. So use something for feedback. So you can sit on like a round ball if you have one of those big physio balls at home. Or if you've got a chair with corners, you kind of straddle the corner of the chair, lean forward a bit. You're trying to get something directly beneath your perineum. And so that way you've got feedback right there. Then when you try to breathe into it, you might feel it a little bit more. Oh yeah, okay, I can feel something. It's very subtle. So that's how we start.
Very good explanation and introduction. So how people can reach out to work with you?
They can definitely find me on my website, Cathy Watson Physiotherapy. I've got lots of, got Facebook, Instagram, all under the same name, YouTube. I'm adding more and more menopause information on there. So it's under playlists, so it'll be easier to find. So I keep putting more stuff on there. And if anybody wants, on my website, on the menu, there's a little section called freebies. And so I have one on core, which kind of looks at it a little bit differently. And then another one on there for, night sweats and how to get a good sleep, all about sleep hygiene. So they can grab that and start on that. That would be a great start.
How you work? Do you work only one-on-one in person, or you work also in online, global?
Yeah, probably 99% of my work is one-on-one in person, but I do still offer telehealth because there's women all over the place. And you can do a lot through a screen, especially on these sorts of topics. Pelvic health and menopause, there's a ton of education. It's a lot of information. And then you can send resources. So women have something to actually do. We want to make sure there's stuff everybody can work on right away and start making changes to feel better. I'd like to say, for your listeners, you don't have to suffer. So you don't have to suffer through crappy symptoms. It's not meant to be that way. And, it's good to start with your GP, always include your GP. But if you have, if you're not happy with that relationship, you seek out a woman's health specialist, seek out your naturopath, seek out your nutritionist, your women's health acupuncturist. It's somebody that's involved in that can help take you to the next level if you don't feel you're getting enough help.
Thank you, Cathy, for all the knowledge that you share with all the listeners. And definitely all listeners, please go check out the YouTube channel of Cathy, and also grab this freebie and start your exercise if you feel that you need some help with the pelvic floor. And definitely talk with her if you're in the area. Where you're located?
I'm in Vernon, British Columbia, Canada. So I'm in the sunny Okanagan.
Okay, so if you're in the area of Okanagan, definitely find Cathy there. Go in person and talk with her, connect with her. Thank you again to listen to our episode every week. Stay tuned for more, and I wish you all the best.
Thank you, Dilyana. This was awesome.
Thank you for tuning into Menopause Made Easy. You can check out more episodes on Apple, Spotify, iHeartRadio, and your favorite podcast apps. Check out the show notes for any website linked to this episode, including where to connect with me on social media. I appreciate you tuning in. Remember to like, subscribe, and turn on your notifications so you'll be updated of each episode release. And visit me at menopausesupportacademy.com for all podcast updates as well. Appreciate you dropping by.